Good afternoon, colleagues. Before we begin, can I remind members, as I always do, just to be careful observing social distancing guidance when we are in the chamber, particularly leaving the chamber and throughout the Holyrood building. We're going to begin with First Minister's questions. And before we move to the questions, could I invite the First Minister to make a brief statement? First Minister.
Presiding Officer, I will begin today with an update on the key statistics in relation to COVID-19. As of 9 o'clock this morning, an additional 33 cases have been confirmed since yesterday. A total of 1,117 patients who are either suspected or confirmed as having COVID-19 are in hospital, which is a decrease of 51 since yesterday, and the number of confirmed cases within that decreased by 6. As of last night, 34 people were in intensive care with confirmed or suspected COVID-19, which is no change on the figure reported yesterday. I'm afraid that in the past 24 hours, 11 deaths of patients who had been confirmed as having the virus have been registered, and that takes the total number of deaths in Scotland under that measurement to 2,386. National Records of Scotland, of course, has just published its more detailed weekly report. Unlike the daily statistics, its figures don't just include deaths where COVID has been confirmed by a laboratory test. It also reports on cases where the virus was entered on the death certificate as a suspected or contributory cause of death. The latest NRS report covers the period to Sunday, the 31st of May, which is 3 days ago. At that point, if I can remind members, according to our daily figures, 2,363 deaths of people who had tested positive for the virus had been registered. However, today's report shows that by Sunday, the 31st of May, the total number of registered deaths with either a confirmed or presumed linked to the virus was 3,911. Of those deaths, 131 were registered in the 7 days up to Sunday. That is a decrease of 99 from the week before. The total number of excess deaths, which is the number above the 5-year average for the same time of year, also decreased from 181 to 108. Deaths in care homes made up 52% of all deaths linked to the virus last week. That is down from 54% in the previous week. And the number of COVID-19 deaths in care homes also reduced again from 124 last week to 68 in the most recent week. National Records of Scotland has also published an additional analysis today covering the period up until the 17th of May, and it shows that up to that point, 154 of the COVID deaths reported in hospital were of people who had previously been resident in care homes. All of these figures are, of course, far higher than any of us would wish, and I'm also aware that no statistical trend will console those who have lost loved ones to the virus, and my thoughts and sympathies are with all of them. However, these numbers do provide further grounds for optimism. The weekly number of COVID-19 deaths has now fallen for 5 weeks in a row. They are now at 1/5 of their peak level. Excess deaths are less than 1/8 of their peak level. Deaths in care homes are also now falling week on week. The figures, in my view, reinforce the decision we took last week to ease some lockdown restrictions, but to do so very slowly and carefully. The progress we have made is obvious, but it is still fragile and it could very easily be reversed. That's why it is still so important that all of us stick to the current guidance. People should still be staying at home most of the time and still be meeting fewer people than normal. Life should not feel entirely normal at present. When we do meet people from another household, we should stay outdoors and 2 metres apart from them. We mustn't meet with more than one other household at a time, nor more than one a day, and keep to a maximum of 8 people in a group. We should all wash our hands often and wear a face covering in shops or on public transport. And if we have symptoms of COVID-19, we should get tested and follow the advice on self-isolation. And above all else, Presiding Officer, we should all remember that the decisions we take as individuals right now affect the well-being of all of us. So I want to end again by thanking everybody across Scotland who has been doing the right thing and assure everybody that it is making a positive difference.
Thank you very much, First Minister. Before we just turn to the first question, just to remind members that I'll take all the supplementary questions today after question 7, after the question from Daniel Johnson. Question number 1, Jackson Carlaw.
Presiding Officer, I asked last week how many elderly people in hospital were sent to care homes before mandatory testing for COVID was introduced. Yesterday, we finally got an answer, more than 1,350 people. As we know, just over 1,800 care home residents have tragically since died, having caught the disease. Today, I want to ask what this government is doing to prevent a repeat of this tragedy. Can the First Minister tell us how many of Scotland's 50,000 care home workers have now regularly been tested for COVID, as promised 2 weeks ago by her Health Secretary?
First Minister.
The programme of regular and routine care home staff testing is underway, and when we have the robust and reliable figures to report from that, we will report that regularly. That's the approach we have been taking to all of the data that we have been publishing. And it is important to note that the testing of care home staff requires to be done not on a one-off basis, but on a regular basis. We will also be considering what further groups of the population we will want to test on a routine basis, and that consideration, of course, also includes NHS staff. In addition to that, we will be doing surveillance testing. That already includes some population antibody surveillance testing. And, of course, the other strand, still the main strand of our testing is demand-led, which is people with symptoms. And we all have a duty, of course, to encourage everybody with symptoms to come forward for that testing, although, of course, that is the strand that we will want to see decline, because that will mean prevalence of the virus is declining. So, in relation to the detailed question, we will publish up-to-date data as soon as we are able to do that in a robust and reliable manner.
Jackson Carlo.
The First Minister says that widespread testing of care home staff is now underway. I'm afraid it's difficult to believe. There are 50,000 care home workers in Scotland. If they were being routinely tested every week, there would be a minimum of 7,000 tests a day. Yet yesterday, the total number of tests done for all of Scotland was fewer than 5,000, and the day before that it was fewer than 3,000. It doesn't add up. First Minister, why are care homes being failed again? Surely by now mobile testing teams or GPs should have visited every care home in Scotland. First Minister, is your government not letting care homes down all over again?
First Minister.
No, is my immediate answer to that. I would also say to Jackson Carlo that the evidence, and I should say as a preface to this comment, that I don't consider any death in a care home or anywhere else to be acceptable, or any level of death to be acceptable. Each and every one of them is a matter of deep regret. But we do see now care home deaths, while of course still too high, declining quite rapidly. And we also see from the peak, certainly through to the middle part of May, that care home deaths have been declining slightly faster than deaths in hospitals. So I say that because that suggests that the package of measures we are taking in care homes and to protect care home residents is having an effect. Now, on testing, testing is important. That is why we have extended the numbers and the groups of people that we are testing. The programme of care home worker testing is underway and will continue, and then will be routine and regular, and the Health Secretary will set out, if it's helpful to the Chamber, more details of the programme of that. And as I said a moment ago, we will set out the data from that when that is available. It is, of course, understandable that we look at the overall number for tests, but I think it is also important to remind people that the dynamics underneath that headline number are also important, because we have different strands of testing. Through routine testing and surveillance testing, we would expect those to increase with time, but the on-demand testing for people with symptoms we will want to see reduce, and may already be reducing because the prevalence of the virus in the community is reducing. So we have to understand, and we will continue to try to publish data that gets to the granularity of that, as well as headline figures. So we will continue to take forward these various programmes of work to make sure that as we suppress this virus and as we come slowly and carefully out of lockdown, testing is doing the job in that variety of ways that we require it to do.
Jackson Carlo.
Presiding Officer, the First Minister has said repeatedly at her daily briefings that we need to do all we can to avoid a second spike. That requires delivery on testing. The First Minister says it's improving. Let me then share some figures. We spoke yesterday to one leading care home provider, Renaissance Care. It has 1,150 staff, women and men who have performed heroic and selfless tasks these last 3 months. But only 649 of them have been tested, just 56%. And even then, not on the repeating basis that the Health Secretary promised on May the 18th. What's deeply worrying is that they say 7% of those staff who were tested had no symptoms of the disease but came back positive for COVID working in care homes. That's the disappointing reality on the ground. Isn't it the case that yet more mistakes are unfolding right now in our care homes and that these mistakes may yet lead to more deaths? First Minister, it won't be possible to blame these failings on hindsight, will it?
First Minister.
I don't blame anything on anything. I take responsibility for the government's handling and response to coronavirus. I do that day and daily. I do it rightly and properly in this chamber. I have never and never will seek to blame anybody. What I try to do, and try to do this to ensure that the public has the understanding it needs in order to know why it needs to comply with measures, as it is explain as we go the developing knowledge we have of this virus. And I think it would be a bit strange and actually negligent of me not to do that and not to explain how our approach develops and adapts as our knowledge develops and adapts. The programme of care home worker testing is ongoing, and those figures, as I say, we will publish, and then people can track that, and it will require to be regular, which I think was, I don't know if it still is, so I'll be corrected if I'm wrong here, that routine regular part of it is different in Scotland to how it certainly was anticipated to be elsewhere in the UK. But everything we do right now is around making sure that we are suppressing this virus and avoiding, as far as it is possible to do, the risk of a resurgence. That's why this government is taking the very careful, considered, slow, steady and cautious approach that we are taking, making sure we are not coming out of lockdown before we have the certainty and assurance that our programmes for testing, whether it's the routine testing or testing through Test and Protect, are able to keep the virus suppressed, in addition, of course, to all of the actions all of us have to take. So we will continue to take these actions. We will continue to take them based on the best possible evidence, and I will continue to stand up here in this chamber and elsewhere on a daily basis and answer questions and explain the response of this government, because that's my duty and responsibility, and it's one I never have and never will shy away from.
Jackson Carlo.
First Minister, the World Health Organization could not have been clearer at the start of this crisis. It told you, and it said it, the priority was to test, test, test. Yet for care homes, with this SNP government, it has been dither, delay and distract. The tragedy is this: Scotland has the capacity to test. Indeed, if you had used that capacity effectively since the end of April, you could have tested all the residents and staff at care homes twice. Instead, capacity is being squandered, and care home workers and residents who have already endured the horror of this crisis are being let down all over again. Why, 2 weeks on from a promise to test all care home staff, is this government still not getting it right?
First Minister.
I'm sorry, Presiding Officer, but the WHO on care homes did not say what Jackson Carlo has just alleged and asserted. In fact, and I'm sure, given that he's based his questions on this today, he has read the WHO guidance that I'm about to refer to here. The WHO issued technical guidance on infection prevention and control in long-term care facilities on the 21st of March. And all of the guidance that the Scottish Government has issued from the 13th of March, which we updated on the 26th of March and then updated again, I think, in May, has been consistent with the guidance, the technical guidance that the WHO has set out. And we will continue to make sure that we adapt our approaches as any evidence and advice that comes from authorities like that change in the future. So we will continue to take the careful and considered steps that we are taking. We will not shy away from the challenges that we face and the unprecedented situation we're dealing with. But the Scottish Government will continue to take that careful, cautious approach, making sure that we, as we have done, build up our testing capacity, but also, crucially, use testing in a way that is clinically driven. And that is the responsibility I take seriously and will continue to do so.
Thank you.